3 different respiratory. Today we're going to talk about nebulizers. So here we go. We're going to discharge with a nebulizer order. There's 2 components. We have our liquid medication that we'll pick up from the pharmacy, and then the nebulizer itself, which in fact is a little air compressor, medical grade air compressor, not the air compressor from the garage. That's a big no-no. Don't do it. All right. So we have our nebulizer machine here, also some O2 tubing, and we have the nebulizer cup. So we'll squirt our medicine in the cup, tighten the lid on, attach our nebulizer tubing, and now we're ready to go. Lots of times people will want to test the machine to make sure it's working, so you can certainly do that with or without the tubing attached, and it's gonna go, it's very loud, all right? So give it a test before, just to be sure, and we'll attach our tubing, and now we'll turn it on. There's gonna be mist coming out. So we're going to try and sit as straight as possible if we're seated at the end of the bed, but always making sure that there is something to support us so that in case, we get a little bit dizzy, we want to be able to take a break. We're going to turn it off and take those few breaths in between until we're ready to do it again, which is very convenient. You can just pause it. So we're going to turn it back on. Remember, it makes that noise. And now we're going to take slow, deep breaths. Deep breaths. Let's say I start coughing. Right? All the med while I'm coughing is going out into the air, right? We're going to pause. We're going to pause our nebulizing so that I can cough. Cough, cough, cough. The other reason you don't want to try to breathe while you're coughing is that a cough is exhaling. So if you're trying to breathe in while you're trying to breathe out, it's a great time to take a break. So we're going to pause it and start again. In general, these usually take anywhere from 5, 10, maybe even up to 15 minutes, depending on the medication that we're aerosolizing and breathing in. When we're finished, we're going to disconnect our nebulizer cup from the nebulizer itself, and we'll open it up here. And we're going to tap it out, placing it on a clean paper towel. The reason we do this is that we don't want to have something sealed up with moisture that perhaps could have gotten contaminated with anything in the air, all right? If we open up our nebulizer, that moisture is able to evaporate, and we'll be able to have it ready for the next dose that we're going to take. The suggestion is that we clean out these nebulizer cups with warm, soapy water, just a little dish water, and then let them air dry for future use. Some people will also rinse the nebulizer cup in between uses prior to air drying. The one thing you want to be sure of is that you're using the correct type of water. Usually distilled or sterile is the best if you're going to be doing that, because eventually you're going to be breathing that in. So we do not want to use any kind of tap water, especially well water, because all the different elements and sediment could be something harmful if we were to breathe that in. So let's say we want to use a mask. There's no problem with doing that. What we would do instead of attaching our nebulizer cup to a mouthpiece is we would choose a different interface to attach, and then it would be shaped to fit on our face like that. After I allow my medication time to do its magic, I may have to do another nebulizer. If you are doing multiple nebulizers in a row, it's time to call the doctor, because there's something going on where you're not receiving the relief from that medication. How do I know when my neb is done, you ask? Well, as we have our neb together, all right, this, what you're gonna hear is a bit of a sputter. So we're watching our favorite show, breathing in deep breath, holding it, and now it goes. I would call that a sputter. As soon as the nebulizer starts sputtering, that is our clue that we're getting near the end of the treatment. And we're gonna turn it off. We're gonna open it up. You may leave the tubing attached to the cup. Not everyone does that. You can take it all the way apart, whatever you prefer, and we'll let it air dry. Happy nebulizing.